With that, we'll go into our weekly update with Kathy McKay, our Public Health Director.
Thank
All
you.
good news this week, I hope.
All good news, yeah. Thank you, Mr. Chair, Commissioners. On May 13th, the governor announced that he wanted a new focus on rapid expansion of testing in our long-term care and assisted living facilities across Minnesota. And of course, I mentioned last week that the Red River Task Force, COVID Task Force that was one of their missions as well, to cover Cass County because their numbers were rising and they wanted testing in all of their facilities. So it matches up with this across the border testing. So in Minnesota, each facility needs to complete a survey that goes to the state. So it just gives them an idea of how many residents they have, how many staff, and kind of the needs in their facility. There's a few questions. And then whether they can, if they have a number of positive staff, that was some of the concern as they do the expanded testing. If they have a number of staff that are positive, then they have to take those out of the workforce. So they needed to have a plan about how would they ramp up staffing as we're doing this testing. There was a emergency management assistant compact for Minnesota requesting some federal assets and resources to help with that because they were concerned that it wouldn't be just in Clay County, it'd be across the state in all facilities. So they are able to help supplement some of that staffing. So that was a good thing that if there's some significant staffing needs as we do a lot of the testing, that they have plans to ramp up and assist with those staffing needs. So a mobile team comes in, and it's mostly made up of the National Guard, Minnesota National Guard, and they are people with a healthcare background, and they come in and actually do the testing in these facilities. So we started on Sunday, and they come in, they provide the testing with some assistance from those facilities, the nurses. They do the swabbing. They brought the supplies in, and then they also can deliver those back to the labs in Minnesota where they're going to be run. We assist by being the liaison with Minnesota Department of Health, and we also assist the facilities with some how those challenges might be met when they come in and do the swabbing. So one facility had a drive-through right by their facility for all the staff. So that worked out very well. The National Guard could swab them as they're driving through with their cars because they're calling all their staff in to get tested. So it worked very well. It was very efficient. And then they had the residents, they went from room to room to test those residents. So far we've tested almost 1,000 residents and staff in those facilities. We're continuing to do the testing this week. There's a number of facilities that are going to be done. And then also next week. So we'll complete all of the assisted living and the long-term care facilities. So that's a very good thing. We're helping to move that process along. And so the first facility tested, I believe, was all negative. So that was very good. So we're moving right along with the same process on the Cass County side. Any questions about the testing, or should I keep going?
I have a question. Are they testing for the diagnostic version of COVID-19 and the antibody as well as the testing?
No, they're not doing the antibody testing.
Okay.
Yeah, just the COVID-19 test.
Right.
Yep. The Minnesota governor, of course, moved to Stay Safe Minnesota, so we're still recommending the covering with masks when you're out in public and wear your eye protection. Stay home if you're sick, the 6-foot distancing, check with your provider about getting tested if you're symptomatic. So that's continuing now. We have a symptom screener on our entrances to our facilities. And I also handed one out. It looks like this. So I didn't get you a copy, but it's on our doors, and the department heads all have that. So when they have appointments that come in, and when they're scheduling them, they can actually ask the questions, and it's the same questions that most places are asking whether they've had a fever, chills, a new cough, shortness of breath, new sore throat, new muscle aches, and a new loss of taste. So that'll be a pretty, it's the same symptom checker that they're using with MDH. So if any of those questions come up, then the departments can ask to reschedule that appointment, because we don't want people coming in sick. We also ask if they can wear a cloth face covering. Now, we're not requiring that because our staff have been equipped to have masks. Our emergency manager got a number of masks, so any of the departments can put a mask on if they think they're going to be closer than a 6-foot distancing, and if that individual doesn't have a cloth mask that they can wear. So hopefully that will go smoothly, and they'll follow all of those recommendations as we do the appointment, back to the appointment only.
So Kathy, can I ask you, so that's in all of Clay County facilities, is that correct?
That's correct.
Okay. So how about here, we're in the cases where again, we have renter facilities, and in the case of the courthouse, we have state-run agencies as well. Are they all following that same?
Yes, I have a staff person on the ones that are working with the court system, so they're making this recommendation. And Georgia did send this out also to all of the tenants, so they will all be following that. The dental office just opened up as well, so they have a pretty stringent screening process. They will take their clients will be outside in their cars, and they will let them know when they're ready to take them in as an appointment, so they are not congregating in our lobby. So that's working out very well. But yes, Georgia shared the same thing across to all the tenants. So they should all be following that recommendation.
DMV the same way?
The DMV, Lori has a copy of that, so I'm sure that's been put on their door as well.
Maybe we'll get to that on Steve's report, but
Yeah.
thank you.
Yeah. So the Minnesota rates, the COVID number of rates have increased over 16,000. Now this is in Minnesota. In Clay County, I think there was a question last week about, do we know how many are tested? They don't have a number of how many are tested, partially because they're getting tested. Most of our tests are coming from the Fargo side, and they don't get the negative tests, so those aren't reported back to the state. So there's no accuracy in knowing how many in Clay County have been tested. They're ramping up their testing across Minnesota. So far they're doing about 6,000 a day, and they'll continue to increase that. The Minnesota case rate is now doubling every 12 days, so that's good. It was 9 days prior to this, so rates were doubling every 9 days. So we're seeing a little bit of a decline where they're doubling every 12 days. So that's a positive improvement. And as you can see from the graph, we've just listed our cases in Clay County. So what our number of cases have been, those that don't need isolation, then the number of deaths, we're now at 20 deaths. So the rates we expect, as you know, to go up. It's really what we're looking at is deaths and hospitalizations that would really impact our healthcare systems. And on our last call with the healthcare systems, they're able to still manage the numbers of hospitalizations and those in ICU in their facilities. So that's good. We've never had to ramp up where they needed another facility to take care of any of the hospitalizations. So that's positive.
What is how many beds are being used right now in the FM area, the ICU rate?
You know, I don't have the ICU rates. We'll hear that on our call this week, but I don't have those rates right now or number of hospitalizations. And we don't directly get that, so I have to ask. I have to make the request to the healthcare facilities. So we don't have that current rate. So last Friday, we received a health alert. The state issued, and you probably heard a little bit about this. It's a mysterious illness that's linked to the coronavirus, and we're seeing it in children. Not here so far, but so the CDC issued this alert about this inflammatory, it's kind of a rare inflammatory syndrome in children, and it can be deadly. So medical professionals in a number of states are looking at more than 200 cases. Now in Minnesota, again, I haven't heard of any, or in North Dakota, but it may be that if they had a case, they haven't presented that information publicly. So it's affecting those that are 21 and under, so it's actually children and young adults. And so it's just a multi-organ inflammatory situation. So they're just watching that. That's something new, and it's linked to the COVID-19. So we're watching that. I believe there's been 3 deaths in children with this multi-inflammatory syndrome. So more to come on that. We just received the health alert late last week on that. And I handed out the safely adjusting the dials. So this is something, again, that the governor has talked about, is where we are at. So if you look at the workplace settings, as we are moving the dial to increase those places, workplace settings, and in social settings. So, we've been just critical services were open, and then some curbside pickup and delivery, and so now we're moving the dial as the numbers are, as the data is showing. So he's watching these dials. So in workplace settings, you can see in the social distancing, social settings, we're still saying 10 people or less. It's sometimes challenging because North Dakota is a bit ahead of us, where they've opened up places, and they're saying gatherings of more than 10 can happen. So Minnesota is just a little bit not quite at that spot yet. I know they're having discussions this week about places of worship and opening up. When are they going to be doing the ability to do some kind of face-to-face in some of those places of worship? And then, of course, school settings, it was distance learning for this year. So when they talk about safe adjusting of the dials, that's the example of what they're using. Is there any questions?
Yes, I have a question, Kathy. You mentioned a word, and then you said inflammatory syndrome. What was the first word that you said in that?
It is multi-organ inflammatory syndrome. So it can affect multi-organs in kids and the young teens and young adults. So multi-organ, kidneys, those kinds of things, respiratory.
So is that a new acronym that we'll be hearing about?
Yeah, if this increases, they're really watching these numbers because CDC has noticed that there's been a bit more that have been identified. So it's a rare inflammatory syndrome, maybe is what you're thinking, but it can affect multi-organs in kids. So it's something they're watching, and they're playing close, watching and paying a close attention to.
Can I have a follow-up to Jim's question?
Yeah.
So, and I know I had heard too that there were 3 deaths associated to that. Do they know, and did you say there was about 200, is that across the United States now?
Right, correct, yep, 200.
And do we know were those deaths associated to underlying conditions as well, or?
I don't have that information. I can try to find that. I haven't heard if they were having underlying health conditions or even if that was reported, so.
Because, in the vast majority of other deaths that this virus has had, it's been associated with other conditions along with it.
Right, so I'm not sure about that, especially, and I don't have the ages of those 3 deaths either.
Yeah,
So that would be
I think
another thing I can see if I can find any information on those deaths.
I think they were kind of on the New York area, if I'm not mistaken.
Yes, I think so too.
Okay,
Right.
thank you.
Yeah. Any questions about what we might be doing here in Clay County?
Any more word from the state on contact tracing?
Yes, the state, so we have, there's 2 things. One is contact investigation. And those are following those people that are positive and working with those individuals. And then contact tracing is the one where we're following up with any of the contacts that they may have provided. The contact investigation, we have one individual, and I think I mentioned our community health board, so Ottertail, Becker, and Wilkin, we each have someone that's been trained, 1 or 2 individuals. So, for example, Wilkin doesn't have many cases, so they can help Clay County in our contact investigation. So that's what we've just been trained for. The contact tracing, Minnesota Department of Health has to ramp up that training before they're going to provide the training on contact tracing. So we have contact investigation going on. They have added additional, so each of the counties are taking, across the state, if they're able to, are taking some of that. So it's freeing up a lot of the Minnesota Department of Health individuals that were working on all of this. And they've ramped up to about 1,400. So they have 1,400 across the state. They keep adding more individuals. So as this ramps up and we get the training, we're still waiting to get the training on contact tracing, we can add more people to our list.
So the purpose behind contact tracing, and then of course, is to notify people they've been around somebody who's had it, and is it then the recommendation that those people self-isolate for
Correct.
the 14-day period?
That's
Is
correct.
that correct? And that's a lot better than having to have everybody go back to doing it.
That's correct.
That's
yes.
the whole reason behind
That's
it,
the
right?
whole reason. Yes, yes. So, yeah, that's a good thing. So we'll continue to do that. Also, Family Healthcare is doing, they started last week, and they're doing testing on all of their patients, and then vulnerable populations. So for instance, anyone in the homeless shelter that would want to go over to Family Healthcare. So they're doing that this week, and I believe they're doing it next week. We did get the information out. They informed all of their patients, so they can come for some testing, but it would be limited to just those that are patients and those that are vulnerable. So we did get it to the homeless shelter in case there's individuals that would want to go get tested, so. Any other questions?
Thank you.
Okay,
All right.
thank you.
Thank you, Catherine, for the
Thank you.
update again.